with how to study anatomy. And this is, I guess, episode 1 of the series. So I just want to make these videos very, bite-sized so you can get a really good idea of what these subjects require of you and how to study them best. So today we're going to start with anatomy. So the books, there's many options, but it doesn't really matter which books you use because it all depends on whether or not books work for you and which books work for you. So there is the BD Charusia Handbook, which usually everyone recommends during your first module in med school, which is foundation. I personally didn't really find it that great of a book. So you can even use your own like textbook, like if you have KLM or Gray's, you can use any of those to really understand your basic concepts because this book is really just a summary of BD Charusia and it just gives you a really, I guess, basic idea. It's not really a necessity. I think you could still survive without this book. It's not compulsory. I did, however, opt for KLM. So you have usually three choices for books, main textbooks. You have Grace, KLM, and BD Charusia. Not the handbook, but the whole BD Charusia series for anatomy. So everyone has different preferences. Went with KLM because that's the textbook that is used for most of my lecture slides at uni, and usually questions come out of there too. So I just found it useful to use KLM for Dow, so that's why I kind of opted for that. The other benefit of KLM is it has really beautiful blue pages for clinicals, so you don't have to go running around for them, but they're really nicely organized. With Grays, the really good thing about Grays is really it's conceptual. It's not as detailed as KLM. KLM is overwhelming with details. Some people also use Snell's, but I have met very few people that use that. So there are those that find that book effective as well. But you have Grace, KLM, BD, Charusia. Those are the main three textbooks that people opt for. I would recommend getting one of the textbooks just as a reference book to have there. You don't have to be reading through every chapter. It is anatomy. Anatomy is more focused on actually recalling and putting those different concepts into memory rather than reading over textbooks. And it's not like physiology where you need to understand things, the mechanisms behind it. The other book that I would say is a must is Atlas of Human Anatomy, the Netter's Atlas of Human Anatomy. This book, don't go without it. I wouldn't call it a supplemental book because it really is a beautiful resource to have there with you. They also have charts at the end of every chapter to tell you different origins, insertions, blood supply, nerve supply of each muscle. The other book I could say maybe is recommended if you're more of a not a visual learner. I feel like if you learn more through doing creative things, or if you want another outlet to really learn your anatomy, is to have the anatomy coloring book. You don't have to use it regularly. It could be used for concepts that you struggle with, and it's just a really helpful resource there for you. And then we have last one, which is it's called the Color Atlas of Anatomy. And this one is actually a dissection anatomy book. I don't have it, but I do plan on getting it because I've heard really great things about this book. So it's really good for anatomy. It's really good to have these books with images. So Netter's Atlas, and then there's a dissection atlas. You don't really do dissections in first year. So, but it's a really good resource to really see the muscles and how they look in real life because in the future that's how you'll be dealing with it. You won't be dealing in pretty diagrams. It's going to be real muscle, real people. So it's good to have that um, look at that sort of resource, to have like a dissection book. And then last resource, I guess this is not a book, but it's KenHub. Some people like to use it. I did use it for 3 months. I just didn't find that it was really that effective. So it really depends on you. You can do a trial run, see how it works for you. I personally did not find it to be very helpful. Then you have a review book, which is called BRS Gross Anatomy. I really love this book. And this is not a book that you're going to be reading over per se. It's just a great resource to have in final exam season when you don't really want to look at a textbook and try to find the information. This book has it organized and it's very small. So it's good to annotate things in here. And to put certain notes or whatever you like to put in here. It's just a good resource to have for final exam season when you don't want to be going through the textbooks. So the top resources that work for my study style really was Instant Anatomy, and I would really recommend looking at this website. And then I have Anki, and then for a pandemic addition, I guess, to this resource list is Sam Webster. He makes wonderful YouTube videos, and he explains the models on there. Since you won't be in the anatomy lab, you won't have access to those sorts of resources. It's good to really look at his videos and get a good idea of how the models look like and how to work with models. And once university opens, you can go to the anatomy lab and look at the models yourself because I do recommend this to be, I do find that to be a very helpful technique and always do it with someone who you can study with. It's good to study anatomy with someone else when you're looking at a model because you're gonna have to really map yourself across the model and see where different things are, and it's good to have some help in that. So using the coloring books for concepts I didn't understand, I did find this to be helpful for me visually. That doesn't really mean that if you're not a visual learner, you can't use coloring books. It's always good to really put in different learning techniques to see what works best for you. So anatomy has three branches, and in this video, I'm talking about gross anatomy. So that's what we just covered. There is embryology and histology, which will be covered in future videos, but I just want to let you know that anatomy is this really huge subject, and what we're talking about is gross. Gross anatomy is the anatomy that you kind of envision anatomy to be like. That's really the anatomy that we're talking about. So what do you learn particularly in first year? So you learn basic anatomy like anatomical positions, types of bones, muscles, different things like that. And then the real anatomy that you learn in first year is really upper limb and lower limb. And that's in your locomotor module. So the bulk of your locomotor module is really gross anatomy. And then you also learn about the lungs and the heart and the anatomy around that. So um, those are some of the concepts that you learn in first year. So, what is the best way to study anatomy? So, what I've found to be really helpful for me is active recall, constantly reviewing, not in a sense where I read over the textbook again, but reviewing in a way that I'm able to test myself with different parts because anatomy really does come down to memorizing a lot of content. But with that memorization, you also have to do a bit of concept building, and that is usually with the nerves. So, with nerves, particularly the brachial plexus, which is a very confusing topic, you do need to have a really um, strong understanding of this because it's a highly testable topic on both your VIVA and your theory exam. So I would really recommend looking and studying the brachial plexus in detail. So not all nerve injuries have the same impaired sensory motor innervation, right? So it's not the same impaired losses. Sorry, I'm going to repeat myself because I don't think any of that made sense. So if you have, let's say, an injury, for example, carpal tunnel syndrome with your median nerve, you won't lose sensation over your palm. And the reason why that is because the nerve passes on top of the carpal tunnel. And you might not understand what I'm saying right now, but essentially you need to know what is the sensory and motor innervation in each types of nerve injuries and where they happen, because there will be certain areas that will be spared in certain nerve injuries. So for that, anatomy becomes really conceptual. So don't take it as a memorize everything sort of subject. It does have concepts, and you do need to know those concepts before you jump into really just trying to put things into your brain without really understanding anything. Um, so the way I would take my process towards anatomy is really I would read through the textbook, and if this doesn't help you learn, then don't do this. I wouldn't recommend wasting your time reading over a textbook if this isn't something that helps you. Anatomy is not something you read, it's something you really have to drill into your head through practice. It's like math, where you don't get better until you practice. And by practice, I mean practice naming different parts, practice nerve supplies, practice blood supply, understanding how things really branch out in the body, like your nerves, how do they branch out, what are the sensory innervations. So these are really really important topics that you do need to know. So I would usually read through a textbook, for example KLM, then watch helpful videos on YouTube. I didn't find lectures to be the first exposure to help me, so I would not watch. I just stopped watching lectures to really help me understand anatomy because it really didn't come down to that. I think I had to look at it myself first before I could just jump into lectures. So do whatever helps you understand the concepts, whether that's coloring, looking at a 3D model online, which there's lots, and you can go on my Instagram page to watch a nice highlight on this, and you'll be able to get a really good idea of, what are the online models that you could use, because there's many. And then you have the noted anatomist. He is by far my favorite when it comes to understanding the lumbosacral and brachial plexus. He has really beautiful bite-sized videos on different anatomy topics. I use Sam Webster to really get a 3D, I guess, view of the model because I didn't have access to it during the pandemic. And then Anatomy Zone, it's really cool because I have used this resource regularly, and this is really beautiful for understanding your different muscles, how nerves branch out. He has really great videos explaining to you on an online 3D model um, the different muscles, different bones, and just covering through a lot of the anatomy that you need for first year. Then the third step is to look at the lecture slides to see if there's anything that you missed out on. The reason why I do this because whatever is on the lecture slides, they can test you on. They have the right to test you on your test. So if there's something that you didn't see in the textbook or your other resources, you can always rely on the lecture slides to get information that you don't know, things that just showed up on lecture slides. Now, the last few steps is really about active recall, and the way it comes down is really going on Instant Anatomy, downloading the images, uploading them onto Anki, which is a flashcard software, and it's free. So this is why it's really awesome. And what you do is you basically have this plugin. It's called image occlusion. What this does is you basically, let's say if you have like a diagram here, you're going to occlude, meaning cover up all the different parts. So let's say you're looking at the humerus. You're going to cover up all the different parts of the humerus. And then what this software does is it allows you to test yourself on each of the different parts. And this is a plugin that you can download easily. Bunch of YouTube tutorials. If you guys want me to make one, make sure to write down in the comments below that, hey, we need a basic Anki tutorial. Anki is really important even if you're considering going to like doing the USMLE in the future. This is really helpful software that many students really swear by in med school. So I would say start using Anki early on in your med school and learn how to use this software. And the other thing, the last step would be to test yourself consistently. Anatomy is something that you forget very easy. I forget it all the time. I have to constantly review it for it to stay in my head. And because it's so overwhelmingly, loaded with information, you do need that time to test yourself consistently so it sticks into your long-term memory rather than just in your short-term memory. So for your clinicals, refer to the KLM Blue pages. I've mentioned this in the beginning. They have really beautifully organized clinicals. You don't need to know all the clinicals. There are certain high yield clinicals that'll show up in your lecture slides. So I would say put more attention to those than to every single clinical you see in KLM. So the other commonly, asked question about anatomy is how do you use Netter's Atlas for all of this, right? So Netter's Atlas is like a map, think of it, like an anatomy map. So whenever you need to really look back at, where a nerve is going, how the nerve really goes down your arm, and you want to see a very, I guess, visual look on that, Netters is where that's where Netters really comes to be of use. So it's great in discussions when you're physically looking at a model and you need to track, where different nerves are and in reference to the model. It's also really great for osteology because usually textbooks don't have the best diagrams, and Netters is just a beautiful resource for that type of stuff. So also another way, if your uni is still not open, you can have online study groups and then have Netters open and track, different nerves, different arteries, muscles, and their origins and insertions. So I really did find Netters to be a great, great resource for actually tracking and really seeing where different things in your body branch out to. So it's important to really take that time to look at Netters. Don't leave it out. I know it really feels weird at the beginning because you don't really know how to use it, but the more you start to use it, the more you'll get used to, seeing which situations it really helps in. So the same is for the anatomy dissection book I talked about. It's really used in reference to supplement your understanding, to basically further give you an understanding of the anatomy that you're learning. So textbooks usually don't have the best diagrams. This is why Netters comes in to be that beautiful roadmap to help you with that. So I'm going to talk about the high yield test topics that are usually tested, and that usually comes with rotator cuff. Do you need to know the origin and insertion of every muscle? No, you don't. But it's good to know those because it helps you understand what the action of the muscle is. Like I said, anatomy is not really memorization. It's actually very conceptual. And if you can understand the origins and insertions, and if you see the direction of fibers, it really helps you to know what function the muscle plays. So the action of the muscles, I would say, is really important to know. Um, for most of the important muscles. And I know, sometimes people get confused with what are the important muscles. So the important muscles are usually the most high yield muscles that are commonly tested on your exams, on your modular exams. So I'll give you an example like gluteus maximus, your rotator cuff, your serratus anterior. There are some muscles that are very high yield on tests, even in terms of nerve injuries. So it's good to know the actions of those types of muscles. The other thing is they commonly ask about fractures and dislocations, particularly with the shoulder and hip. Shoulder is very unstable, so it gets dislocated very commonly. So you need to know what nerve could be damaged in, let's say, an inferior dislocation. Same things with hip dislocation and femoral fractures. It's good to really get a beautiful understanding of those. The last thing I would probably talk about would be the knee joint, which is a very, very important joint. I know I haven't written it down here. Um, but make sure to understand, things like um, ACL, anterior cruciate ligament, lateral, collateral, the lateral, the medial collateral. Really get a good understanding of the knee joint, the anastomosis around it. It's a very important joint to understand really well. The anastomosis that are important, if you don't know what an anastomosis is, it's basically a bunch of arteries come together and kind of, connect. So let's say one artery is damaged, there's going to be an anastomosis, which will provide like an emergency circulation to that area of the body. So if the hip has an anastomosis, the scapula has an anastomosis. Know which arteries play a role in that, right? So knowing the branches of the axillary artery and the subclavian artery is very important because it helps you understand the scapular anastomosis, which is a very important topic to study as well as the hip. The brachial plexus, you need to know absolutely everything about this. So don't sit there and cover the basics of it. You need to understand it, and it will take time. Trust me, when I first started the brachial plexus, I don't think I understood it until I probably reviewed it probably over 20 times because it really is one of those topics that even after first year med students are still confused with it. So make sure to really take that time and give that time to brachial plexus and ask questions about it, discuss it. This is a really great topic to discuss with friends because it's one of those complicated topics that you need help in. It's good to get that support of study groups. So the lumbosacral plexus is also as important. It's a little difficult. It's a little more difficult than the brachial plexus because it has more nerve roots. But one benefit with the lumbosacral plexus is you don't need to know a lot of the nerve injuries for it. But you do need to have a basic understanding of things like nerve roots, foot drop, Trendelenburg gait. You have the high steppage gait, just different things that are usually tested on your test. So even functions like the gluteus medius, gluteus minimus, what they're innervated by, knowing what goes above and below the sciatic foramen, things that you might not know what I'm saying right now, but once you get to them, you'll probably see why they're important. Then you have the boundaries and the contents. And this is a highly testable topic on your VIVA. So your oral exams, they do ask a lot about, what are the boundaries of the femoral triangle? What are the boundaries of the cubital fossa? What, just know all the boundaries and contents and memorize them because this is one of those things where it's not really conceptual, it's very memory based, so you need to memorize those. Have a good understanding of the arterial supply of both the upper and lower limb. Know how arteries terminate, know how they originate, know where they end, where they begin. There's certain landmarks you need to know for the axillary artery, like the teres major muscle. So please take that time to understand arterial supply because if you understand the arterial supply, you're going to understand the venous supply. So make sure to really drill those different concepts that are high yield. So VIVA, like I said, they test you mostly on nerve injuries for the brachial plexus. There isn't a lot of osteology on Viva, so I wouldn't recommend spending a lot of time during your prep month covering osteology. It's not as important. That has been my experience. It might be different for your university, so I would really suggest looking over past papers as your biggest resource for doing it, just preparing for any test. Boundaries and contents, like I mentioned, is very important. And for lower limb, you do need to know foot drop and trend deliver gait. Now, I know I didn't talk about the lung and the respo anatomy, but for that, it's mainly really knowing the boundary, not the boundaries, sorry, the surfaces and the borders of the lung, the heart. You have to know where the apex is. You have to know things like arterial supply of the coronary supply, sorry, the coronary artery supply of the heart. Um, which are the arteries, what do they play, what do they supply, because those things will become important when you're learning about infarctions and which areas are supplied by which arteries. It's good to really have that understanding. And for lungs, you do need to know what's in the hilum, you know um, what's the difference between the right and the left lung. So those are, I guess, smaller anatomy subjects that come up in other modules, but just to give you that heads up that anatomy almost comes in every module except for blood, which is very, very little anatomy, I would say. So all the other modules do focus, especially on locomotor, for the bulk of your anatomy, because um, this is really going to determine the bulk of your locomotor module. So, what are some helpful YouTube channels? So, like I said, my top one that I would recommend you guys really check out is a noted anatomist. Then we have Anatomy Zone and Sam Webster. I've explained these, so I hope this was really a good idea of how to study anatomy. What are the different resources? When you were studying for exams, I would really recommend just going over past papers. I've mentioned this a lot of times on my Instagram as well. Is that when you're studying for exams, always rely on past papers and understand why you got questions wrong. One of the advice I got was from a student who had a really good GPA, is know why you got different answers wrong on the past papers. Really understand why the other options are not right. The more you practice with past papers, the better you'll know how to read between lines. The other beautiful thing about past papers is questions repeat. So you might get a question that you may not have known the answer to, but because you did the past paper, you knew the answer and you could do it on your real exam because that question repeated again. So questions do repeat because the question banks are very small. So take that time to look at past papers for your theory exam as well as for your Viva. There's past papers for Viva too, which is where students basically upload the questions that they got asked at different Viva stations. And I'll explain to you guys how Viva really works. But for now, I think this is a good place to start to give you a basic idea of how to study anatomy. And I hope this video was helpful. So make sure to write down if you guys want me to write, if you guys want me to do more subjects, what subjects do you guys want to see more of? Subscribe to my YouTube channel. If you're not following my Instagram, do follow. I am active on there. If you need to message me anytime, I'm really fast at replying. Also, check out my blog. I upload really helpful content on there too. So, yeah, subscribe to my YouTube channel, and we will see you next time. Have an awesome day, guys. And that's Metastic Days out.